Hi, today we're going to be reviewing a number of questions that were sent in to me through SpeakPipe. This is a new format that we're doing where we allow our audience to directly reach out to us and leave questions. We try and get to as many of them as we can, and also send us questions on SpeakPipe.
In a recent YouTube short, you talked about how benzodiazepine protracted withdrawal can be permanent.
Can benzodiazepine withdrawal be permanent? The answer is yes.
But then towards the end of the short, you said that typically most issues resolve over time.
But in general, most people recover.
And so I was a little confused. Is it permanent or do they resolve over time? I'm 3 years out. I'm completely disabled. My memory is in the second percentile. I graduated very high in my class. So I know that this is from benzodiazepine cold turkeys and taking it for 12, 14 years. And I'd like to know whether I should be trying to accept my current situation as it is, or if I should expect that these symptoms should resolve over time.
Holy hell. My heart goes out to you that you're in that situation and you're still having a lot of disability 3 years down the track. Usually it does improve gradually over time. In fact, this is what's happening in the majority of the cases that I'm seeing in my private practice. However, the improvement sometimes is on the course of several months to sometimes up to like 5 years. And I do know cases that have gone kind of 10 years plus. Nicole Lamberson, who's on medicating normal, she's talked about her experience before. She's over 10 years out. She's still having a lot of disability. However, she's made remarkable improvements over that time. And so what I will say is that protracted withdrawal injury from benzos or antidepressants, it actually has a good prognosis if you can survive long enough. So it's usually kind of settled into its level of severity, usually by about 6 months to a year, usually sooner than that. And then after that point, it doesn't get any worse. And what that means is that gradually as the months and years go on, it recovers steadily. Some people, they're actually a lot better by about, 12 to 18 months. But then the majority of people that I see, kind of fall a little bit after that. And I'd say the next chunk of people, they're probably better by about 5 years. So that might be where you are, that you're still going to experience like some improvement, some decent improvement up until the 5 year mark. And then there is a tiny, tiny fraction of people where it seems to last from 5 years and on. But usually what we see in those patients is that they're still making steady, gradual improvements over time. Their quality of life is improving. And so there can, it is possible that some people never get back to where they were before. But the point I want to make is that you should not be giving up hope, because the brain has a tremendous capacity to heal itself. And if you're just doing all of the right things in terms of nutrition, trying to live as healthy as you can, you're going to put your brain in the best situation to recover as much as it can. I want this to be a message of hope. And so, because it really is, there is tremendous improvement that does happen over time. So please have some cautious optimism that things are going to keep on getting better.
What are your thoughts on doctors' education, and how can this be improved or changed?
How can it be improved? So my thoughts is that the education of psychiatrists is terrible, and it doesn't really set them up to be that helpful. This saying that when all you have is a hammer, everything looks like a nail, and that really relates to psychiatry. It's no surprise that psychiatrists really aren't taught that much psychotherapy anymore. And so they're not really skilled in helping people with a lot of the kind of the problems that people are having. I mean, we're talking about universal problems of like living really being responsible for a lot of anxiety and depression, relationship problems, career problems, existential problems. And then there's things that psychiatrists can't even help, such as like poverty, and economic hardship. And so most psychiatrists, they don't know how to do any of that stuff. They're essentially just trained to use medications. And because of that, they have a really kind of, what I think is a really kind of watered down and reductionist view of psychiatric conditions. They're frequently taught to see all of depression and bipolar as just these like mood disorders. And that's because they just have the medications to fix it. What can be done about it? I mean, I think there just needs to be this honesty within psychiatry where they recognize, first and foremost, that the drugs really, they have to be used in a very small fraction of people after all of the other problems have been addressed, which can be addressed, that are modifiable. They need to have the humility to understand that a lot of the problems that they're being asked to fix, they can't do anything about, whether, like poverty, things like that, economic hardship. Like, why would you want to put someone on a drug if most of their problems are coming from that? Like, sometimes you need to just be honest that, hey, we can't help you. And I think a lot of the time psychiatrists feel there's this pull and this need that you need to give someone something to like help with everything. In the long run, I think that really messes people up. It's going to be a hard problem to fix because, so much of how medicine is practiced these days is kind of like a conveyor belt. It's very like in and out in like 15 minutes. And there's massive forces behind that. There's the way we reimburse medical care. It's just like, it's not really focused around getting outcomes for patients. It's more focused on just seeing them really quickly, and that's how you make money. So I think that system would need to change into a more outcome-driven system. Also, there needs to be just a recognition that, the pharmaceutical industry has really kind of flooded the medical literature and the conferences with a very biological take on mental illness. I think residents need to be taught this and be taught that just because you hear something again and again and again doesn't mean that that's the predominant way to look at mental illness, and there's actually commercial interests behind that messaging. And so those are a few of the things that I think would allow residents to come out of training and have just this more holistic view about what's going on and actually be able to help people without harming them.
Mental illness isn't trendy.
Okay. So that was it. That was the whole message. And this was based on something I said on TikTok that I thought mental illness was increasingly trendy. And I get it. Not all people want to have mental illness. They suffer from it. They're not trying to look for attention. All they want to do is feel better. But God, just go on TikTok for a second and have a look at some of the things people are putting out there. They are so identifying with their condition. They're talking about all the medications that they're taking. There is a proportion of people out there who make this their identity because, I don't know, there's something kind of, I don't know what it is, romantic about having bipolar disorder or having this kind of dark side to yourself. And I think people really turn it up and they make it part of their identity. So obviously it's not trendy for everyone, and some people hate having mental illness. I get that. But there are a group of people out there who just love to be mentally ill.
I don't think I've seen you cover anything about agoraphobia or panic attacks during a taper. I was wondering if you could cover that topic because I'm currently tapering and I had a panic attack, and that has led to a couple more panic attacks. And my theory is if I just reduce stress and panic in my life, the situations that cause it, this will get better.
What a great question. Okay, so Mike, everything you're experiencing is really typical for protracted withdrawal. So the number one symptom that I see with protracted withdrawal, and this is antidepressant and benzodiazepine, is a high baseline anxiety, panic, fear state. So let's say that a normal person is maybe they're living at like 20% anxiety most of the time. When you have protracted withdrawal, like the most common symptom I see is people live up here at like 90%. They never really feel relaxed. They feel kind of on edge. And because of that, they start tipping over into all of these kind of panic attacks and sometimes even states like agoraphobia. And that, for those who don't know what that means, that's when you're afraid to leave your house. A lot of other ways people have this is sometimes they have something called monophobia, is where they're afraid to be alone. There's two ways of looking at this. So the first way is little exposures. And so the one thing that you might like to do is to say, hey, I'm going to actually just go outside of my door today. And you just try that. And then you feel good about yourself because you did that and you were able to deal with the panic and you didn't die. The next thing is you might go to the end of your driveway and you would slowly increase the number of things you're doing. And the reason is that you want to teach your brain that going outside is not frightening or scary. So that's one way that you would look at it. You would treat it with gradual exposure and hopefully kind of widen your world so that you're not trapped in your house, which is also kind of traumatic. The other thing that is specific to protracted withdrawal and which you have to kind of really feel out is what the effect of additional stress on your body is. Now, some people, when they're in these protracted withdrawal states, they're going to find that if they go out and they have a panic attack, they almost have like this hangover where for the next couple of days, their symptoms are a lot more like severe. And so they're actually going to choose to do less because they actually have flare-ups of pain and all of these things that go on. So I've seen that sometimes. And so if that is you and if that's your situation, you need to be really like careful about how much you do. You don't want to kind of push yourself into this adrenaline surge where you're completely depleted for days afterwards. I hate to say it, but this stuff can last a long time. And so to the extent that you're able to live a normal life, and that means leaving your home, you should try to, even if it is really uncomfortable, because that's at least going to be a distraction from the severity of the symptoms.
Hi, I have a question, and it is, what does a Scientologist, psychiatrist think about Amber Heard and Johnny Depp and what happened in their divorce? Was Scientology at play? And what was going on?
So first I'm going to say, I'm not a Scientology psychiatrist, but what do I think about what happened between Johnny Depp and Amber Heard? Honestly, I don't really know. I know they had a terrible divorce. Was Scientology involved in some way? I actually took a break to do some research on this on Google, and I did a lot of searching, and I could not find anything about Scientology being involved. If you know something that I don't know, something that's been scrubbed from the internet, please let me know in the comments below, because I'm really curious to find out whether Scientology was involved in some way. So thanks, Hubbard. Hey, just want to interrupt quickly and just say if you're enjoying the content that we're producing here, that you consider liking, subscribing, and commenting on the videos. These are the type of things that gets this video kind of pushed to broader audiences, and it can really help us.
I wanted to ask if it's possible to basically recover from generalized anxiety disorder without medication. I have been diagnosed with generalized anxiety disorder like 4 months back, and I was prescribed paroxetine 25 mg once daily. That was like 4 months ago, and I haven't started antidepressants yet, but I'm recovering slowly. Or is there any other alternative way of getting through this?
Yeah, so this is a really great question. Thank you so much for reaching out. It really starts with being curious about generalized anxiety disorder. And so before you accept that, you're just anxious because of your constitution or your brain, there's a number of things that you need to rule out. And so the first thing, which I see is really common actually, it's using other drugs. And I don't just mean like street drugs or cocaine or methamphetamine. This can be things as simple as drinking a lot of coffee. It can be things like using nicotine, or anything that has these nervous system effects. And so if you're using a lot of these things because you're a busy doctor and you've got a lot going on, I would highly recommend that you come off all caffeine and nicotine for at least a month and just see how you feel. A lot of people will notice quite a dramatic improvement in their sleep and less anxiety. So that would be the first thing that I would look at. Other common masquerades can sometimes be dietary. This is especially true if you're actually having maybe some stomach problems. If you notice that you're having almost some like irritable bowel syndrome symptoms, like alternating like diarrhea, constipation, heartburn. If you're having any kind of rashes or itching, sometimes these are symptoms that you have an overactive immune system. And I've actually seen a lot of anxiety recover with elimination diets. There's a lot of stuff from the Institute of Functional Medicine on elimination diets, but essentially it's eliminating gluten and dairy and other inflammatory foods. And so I would definitely give that a go for 3 months as well, if that is fitting. And then the final thing is what is really very intuitive. A lot of people have anxiety because their life is stressful. There may be things out of balance in your life, whether it's in your relationship or whether it's in your career. Speaking to a trained therapist or a coach, someone who can help you find better ways of dealing with those natural stresses that may come up is a great idea. Trauma can also play a role in this. And so those would be the 3 main categories of things that I would look at addressing before you expose yourself to a medication that, like an SSRI like Paxil or paroxetine, that could possibly have pretty bad side effects.
So do you see psychiatric coercion and non-consensual psychiatry as the human rights abuse?
Yes, I do. And I actually see this happening all the time, and I hear it happening all the time. Sometimes people are almost pressured out of emergency rooms to go into inpatient psychiatric settings. They'll say things to the patients like, if you don't sign yourself involuntarily, we're probably going to commit you. And then also, when they're on inpatient units, a lot of the times, if they're on an involuntary hold, even if they don't want to take a medication, over time they learn that unless they just do what the psychiatrist is telling them, and unless they just kind of play along with what the nursing staff want, they know that they're not going to be let out. So a lot of people who, might have even have been damaged by psychiatric medications feel like they're literally in a prison unless they agree with medications. And probably one of the most horrific stories I heard about this was Rosie Tilley, who I did an interview with on PSSD, who essentially, was sectioned in Australia because they thought that her concern about her sexual dysfunction was psychological and that she was just delusional. They then made her take a medication, even though she didn't even want to take it because essentially she thought it had damaged her nervous system. She was pressured into taking a medication and pretending that she was doing okay so she could get out of that situation. And so I think this is happening all over the place.
I've been off Klonopin for about 14, 15 months. I was on it for 30 years. My psychiatrist gave me 4 weeks to get off. So anyway, my question is, why am I having such intense itching all over my body?
So what you're describing to me, just based on what you've put in the message, is peripheral neuropathy. And so one of the symptoms of protracted withdrawal is nerve damage. And when nerves are damaged, they begin to misfire. And people can feel this in a number of different ways. Some people feel it as numbing. Some people feel it as kind of tingling. Some people feel it as pain. It sounds like you're experiencing it as itching. And so you've got damaged nerve fibers that are sending, aberrant messages to your brain. At 14 months off, this isn't some withdrawal reaction anymore. It's likely nerve damage. And you could be hopeful about this because what I've seen in many of my patients is that the peripheral neuropathy actually does improve gradually over time. And so if you just keep on going, I suspect you will notice gradual improvements in that itching. Obviously, I haven't examined you or anything like this. You're going to want to talk to your doctor about this perspective and also, make sure that you're not missing anything else. But I have seen stories just like yours in my protracted withdrawal patients.
I take quetiapine and nortriptyline, and I've been taking them for, quetiapine for about 12 years and nortriptyline for about 30 years. And I would like to get off them. I've had no hope until I heard about the possibility of a keto diet helping. So I'm on the keto diet. It's been about 6 weeks now, and I'll wait for a while to see how it goes. But the main issue is sleeping, and if there's anything you can say about those two drugs and withdrawal symptoms, and the optimal way to wean off them, much appreciated.
Okay, yeah. So bear in mind, I'm not your doctor, and you'd have to run everything by your physician. But here are a couple thoughts that I would have. Nortriptyline and Seroquel both can be somewhat sedating. Definitely more the Seroquel than the nortriptyline. And so, what I would say is that one, keto diet is great. I think, especially if there was some degree of insomnia or anxiety or depression that was caused by dietary problems. Sometimes that stuff clears up on keto because a lot of people drop things like gluten, but it's not going to mean that the taper is going to be completely smooth. I mean, it may, but usually they're difficult even after 30 years. So if you were a patient in my practice, what I would do is I'd probably tell you to start with nortriptyline. We usually recommend tapering, the more sedating drug, second, because sleep loss is demoralizing. Tapering nortriptyline, probably the best way to do this is to look to see if there's a liquid formulation from a manufacturer. If there isn't, you could compound it, and then you would just follow the general tapering principles, which is really 5 to 10% reductions over about 30 days. You could do that in one big step down, or you could do it in lots of little micro tapers over 30 days. I've got a lot of videos about that on my YouTube channel. After you've done that, you would want to go and taper the Seroquel. And so my final thoughts just about sleep during drug withdrawal is that you're going to have disrupted sleep. And I think you just need to really accept that. People come to me a lot of the time and they say, how can I taper off my medication without disrupting my sleep or worsening my anxiety? And I tell them that's impossible. The whole process of coming off sedatives and anxiety reducing medications is to have your brain regrow those parts that have been suppressed by being on that medication. So it involves a degree of insomnia and higher anxiety, which is actually therapeutic because it's sending messages to the other parts in your brain telling them to regrow. And so I would look at it like that. The reason we taper slowly is we want you to do this without the anxiety and the insomnia becoming so out of control that it affects your life.
I've seen a lot of people develop histamine sensitivity while they're tapering mirtazapine. What are your thoughts on that?
Yeah, my thoughts on that is that it's really expected. I see a lot of histamine sensitivity when people are tapering off drugs which have these strong antihistamine effects like mirtazapine and sometimes even Seroquel. And so it's expected. It's expected from the withdrawal process. People will have sensitivities to foods. Sometimes they can develop skin rashes and things like that. This resolves gradually over time.